Welcome to episode 185 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. Today is Friday, November 11th, 2022. It's Veterans Day, and in honor of Veterans Day, Rear Admiral Pam Schweitzer is my guest. If you haven't heard of Rear Admiral Pam Schweitzer, she is a pharmacist, and she was the first female Assistant Surgeon General of the United States. She retired in 2018. Throughout our interview, you will hear me address her as Pam as we discuss her career in the Public Health Service, the Public Health Service Women's Leadership Support Group, her vision for interoperable medication lists, her appearance in an upcoming PBS documentary called The Invisible Core, and more. If you're new to the Pharmacist Voice podcast, welcome. Again, my name is Kim Newlove, and I'm the host. I'm a pharmacist by training, but I'm not in clinical practice anymore. I made a career transition to voice actor and podcast host. Among other things, I narrate audiobooks for women pharmacist authors, provide medical narration to clients in the pharmaceutical and biotech industries, and narrate content for explainer videos and e-learning projects. I was inspired by my nonverbal son who has autism to combine my background as a pharmacist with my speaking voice and launch my business, The Pharmacist Voice, in 2017. My son Craig helped me realize the power of having a voice and using it. My solo podcast episodes are about some aspect of being a pharmacist, a voice actor, a pharmacist podcaster, or my career transition from pharmacist to voice actor and podcast host. My interview shows feature a variety of people who use their voices to advocate for something, educate in some way, or entertain so that you are inspired to use your voice too. This is episode 185, and you can find the show notes on my website, thepharmacistvoice.com. Just click on the podcast tab and search for episode 185. Without further ado, here's my conversation with Rear Admiral Pam Schweitzer. Hi, Pam. Welcome to the Pharmacist Voice podcast. How are you?
Oh, wonderful. Thank you for having me today.
Oh, it's my pleasure. Happy Veterans Day.
Thank you very much. Appreciate you recognizing the U.S. Public Health Service Commission Corps.
Yes, well, thank you for your service.
You're welcome.
As we begin this interview today, I want to make sure that we put front and center that pharmacists can have careers in uniformed service as federal pharmacists. Can you talk a little bit about your experience and what you would recommend for any pharmacist who's looking to become a federal pharmacist?
Sure. I'm going to tell you the experience. I've actually been part of two federal agencies. I worked a little bit for the Veterans Administration, and there I was around several pharmacists that actually had served in the military, served in the armed forces. So that was a great experience. And then as a pharmacist, I did that. And then I also was in the U.S. Public Health Service Commission Corps. And there I was around, there were 1,300 pharmacists. We were all active duty. And I first went into the service. I actually didn't know about it. I didn't hear about it in school. I first went into it when I went to a pharmacy meeting and I saw a booth, and it intrigued me because it was pictures of Alaska, and the person behind the booth was Rear Admiral Dick Church. And when I went up and talked to him, he told me about the Indian Health Service. I had not heard about it. So that's what actually, when I got called to active duty as a commissioned officer, I was actually went into the Indian Health Service. And the reason why that was so important at that time was because the Indian Health Service, there were several tribes that were trying to staff and provide medical care to the American Indians and Alaska Natives, and there just wasn't enough staff. The federal government needed to help support and provide staffing for those, and pharmacists played a really key role. So they were really having a hard time staffing these really remote sites, and I went to South Dakota. That's what actually brought me to South Dakota, and it was very remote. It's something I had never been exposed to. So, over time, let's fast forward, I found out that our federal pharmacists, were actually in several different agencies. And at least for the pharmacists in the Commission Corps, we were in at least 12 agencies. So the Bureau of Prisons, Immigration, CDC, FDA. We had several pharmacists in the FDA. We had them in NIH. I mean, there was 12 agencies. And so anyway, providing all different kinds of services. So anyway, it was eye-opening for me, and it was like basically open up my eyes to care. We also had several pharmacists that were actually assigned to in the DoD. So they worked for the Defense Health Agency. They worked in just any place that was federal where there was a skill set that needed either a pharmacist or the skill sets that the pharmacists have over time. It could be administration, it could be project management. I was at CMS for a little bit, and there I was using my project management skills besides pharmacy too. So there's all these skill sets that you gain over time, and we were just sort of spread everywhere.
That's amazing. And your career was over the span of more than 2 decades, wasn't it?
Correct. I served a total of 29 years in federal service. So it was the best career. I never dreamed of having a career that would just really excite me every single day, where it would the work was it was passion is really what it was. It was never a job for me. It was passionate. And it's interesting because what ends up happening, the types of folks that come into the Commission Corps, we all of us, you end up meeting people that are very similar. They want to make a difference in the world. They want to make our country better. They want to serve. They're community oriented. And then sort of this driven, we have the core values that the pharmacists, that people in the Corps have, are, excellence, always striving to become better, always trying to improve, always wanting to learn more, the leadership skills. And I actually learned to lead from behind, but just the leadership skills to help to try to influence and try to help make changes. Those are all skills that you kind of learn over time. Integrity. So integrity is a real big one too, because just, when you've, following through and just the way you carry yourself, that's all real important. So anyway, as it turns out, you meet people that are very similar to you. And you can meet them outside the service too, but it was great to be part of this family that we all work together, and we put the mission first. We put what we're trying to work towards first. And it's not about me, or where I want to go or whatever. It's really trying to really make a difference. So that's like so lucky to have a career like that.
Yeah, I'm actually jealous. I would love to have worked for the Navy. That was my first choice right out of college. Didn't work out for me, but I get to hear about careers like yours and all the things that I could have learned. And it makes me just as passionate about reassuring young graduates that that is an opportunity that you should actually embrace. You should consider federal pharmacist service. There's two things that you talked about just now that I want to touch on. One was teamwork, the other is leading from behind. Can you talk a little bit about what it means to lead from behind, learning to lead from behind?
I learned to do that when I was in the Indian Health Service, because part of what I didn't realize when I came out of school, my first duty station was in Pine Ridge, South Dakota. What happened is our role there wasn't to come in. This is what you think. Our role isn't to come in and say, "Oh, the community, we need to do this, this, and this, and this." What it is listening to what the community is wanting. And so for them, what was important to them may have been something different than what was important to me. And so what happens is you hear, we need help with this program here. I could go in and take over and do the program, but that's not the right way to do it. The right way is to have them lead and me help support them. So it might be providing ideas. We can do it this way, or this way, but they determine what the decision is to move forward. So we had a chance, and I'll give you an example of just something like they have. We were working, and actually for a little bit, I was the Health Promotion Disease Prevention Coordinator. So that's when I was really working with the community. So meeting with them and determining what's your priority. Well, what was important to them is our children have car seats, or maybe it was important that we take care of our elders. So then help them to come up with ideas, expose them to other things, but they choose, and then we help implement from behind. So it's never It's never looks like I'm leading it. It never looks like we are leading it from the outside. It's their own internal leadership is leading it. And I will say that's over and over and over. You do that over and over and over again. It just becomes second nature. So the same thing like Ebola. We had several of our officers go over and support, over in Monrovia, we had a medical unit over there. It wasn't about them taking over. It was about working with the community to help them do it. And the same thing for any community we go into. It's pretty common to go in and you work with them, and the ideal thing would be to pass it on. So over the years, as I was in the Indian Health Service, the tribe started taking over. I worked for a tribe. At one point, I was assigned, I was at a tribe, worked for a tribe, which is different than the Indian Health Service, because a tribe is running their own health care. My goal is really to work myself out of a job. Then I'm doing my job. So you work yourself out of a job, you make sure you hear their mission, you hear what's important to them, and then try to help move in that direction so that when I move on, then I've left them with owning it. So it's a skill set I unconsciously learned, and then it was on purpose after a while. So almost every project I ever did, it was always pulling people, getting everybody rounded up, working as a team, and trying to move forward so that as you move on, I always call, so the project lives, so whatever you implemented lives, so it stays going when you're not there. It seems easy to do, but it actually takes a little bit of time. You can't be in a hurry to make sure it sticks.
That reminds me of a book called When Helping Hurts. When people go to these third world countries on a medical mission and they bring in all the modern medicine and they set up a clinic and they think they're helping a bunch of people, but when they leave, then those people that they've helped no longer trust their local medical care providers. So it's when helping hurts. What you guys did, on the other hand, was go in and find out what the problems are and help the people who are already the leaders solve those problems. You just supported them. And I love how you said you worked yourself out of a job. That's actually not a bad thing.
That's exactly right. And so you'll see a lot more of that being done, because we realize that's actually the best thing. And it's not, anyway, it's been just a wonderful career, and I moved from job to job to job, but it wasn't because I was running, it was because there's so many opportunities. We need some help. And a lot of the Commissioned Corps officers, we end up project oriented, like we are over this initiative, working on this initiative. So I'll give you a couple examples of initiatives I was on. I started out as a clinical pharmacist, and I love seeing patients. I loved that part of the job. That was like a highlight for me. But what I realized is when they start cut funding, or when there's a staffing shortage, or when there's these other challenges, wait a second here, we need to get more efficient. So I got into automation, and I realized if I was the pharmacy director, I could help drive this a little bit easier. So anyway, we had to move towards automation. So then I got into IT. And then from there, we were able to sit and justify positions and kind of work with the medical staff and make sure that pharmacists were integrated on the healthcare team. So that took a little bit of time, but then we realized, okay, now we're always a burden to the health system because pharmacy costs are so high. How do we work on that? So then I got into pharmacy billing. So I got into all these administrative projects and it was really so that the pharmacist could practice clinically, so as efficient as we can, so that we could show our value. So we were constantly having to collect data to show the impact of the care that we provided. So I sort of grew up with that, because we didn't want to have our positions cut when the money got tight.
Yes, nobody wants to lose their job. But speaking of moving among all these different positions that you've held, did you get to choose when it was time to move on, or were you assigned, or maybe something else?
That's a good question. No one's really ever asked me that. What would happen is I always knew there was so I'll just kind of give you an example. So usually what drives our and I'm just going to talk a little bit about the promotion piece, is that, you go and you set down and you might be there a few years, and then it's time. We weren't assigned. It's not like the military where we were assigned, okay, now you got to go over here. There might have been a few instances when that happened. For deployments, that happens. It was my first duty station, I was assigned. But then later on, what happens is, as you're working on a project, okay, I've got this down. It's time to look for a new opportunity. And so they'll say, okay, there's these three things that we need done. Which one would you want to do? So then I went to the next one. After that, once I got to more leadership, when I was more of a regional national person, it was really, I see what's coming down the pipeline, and I'd say, hey, if you need some help with this, I'd love to be part of this project. So I'll give you an example. I was doing pharmacy billing for a while, and then I said, oh, I see that you're moving from paper to electronic record, going from paper to electronic. I would love to be part of that. And so they said, sure, I could be the transformation lead. So that was national. That was like fun for me, if you can imagine, to be able to do that. And that was a couple of years. And then you see another opportunity. I did the residency program for a while. So what happens, it was more seeing the opportunity. It's an opportunity for me to grow, for me to learn something new, a whole new skill set. So it was always seemed to be new jobs, but I was never told you have to do this. You have to do this later on. Early on, maybe a little bit, but later on, no. It was more for the CMS. When I finally got there, I had said, hey, if you need help with the Affordable Care Act, and they said no in the beginning, but then later on, they said, oh yes, we can use you now. So are you still interested? Sure, I'll come. So it was a little bit like that. So I wasn't assigned. It was more, they were looking for a specific skill set.
Thank you for sharing that. Any pharmacist listening to this who's interested in the type of uniformed service that you were part of might be interested to know that you are not assigned necessarily. You do get to choose your opportunities. That's important. And the highest ranking position that you had was the Assistant U.S. Surgeon General. How did you come upon that position? Because I'm guessing there was more than one person interested in that one.
Thank you for asking. So what happened was, every 4 years, it's a 4-year term, and every 4 years they put a note out to anybody that would be qualified, and anybody that's qualified, they pretty much put it to a lot of the captains. You have to be in good standing. They put a note out to anyone to see who's qualified. About that time, and I should probably say, throughout my career, we have mentors, and some of them are assigned, and other mentors are people that just, you have adopted you or whatever, or I adopted them, either way, that are just talking to you and giving you the big picture and just helping to mold you. You don't know that it's happening, but then you look back. Now I'm looking back, I realize they were mentoring me all along. So I had some of my mentors encourage me to submit my name in, to do that, to submit my name in. They said, Pam, you're ready. And of course of course I would say, no way, this is a little bit overwhelming, especially because I was following someone that I thought was an amazing leader, which is Admiral Scott Giberson. So anyway, I put my name in, and, you just go through this, a big selection process, a lot of vetting that goes through. And I think I had known I was selected probably about 4 months before it was announced, and I had to keep it quiet. My family knew, but I had time to get ready for that. So I had time to ponder and think, which is really great, to think about what am I going to take. And as Admiral Giberson had told me, when you get in here, make it your own. So that's kind of what I did, is made it my own. And I had in mind what I was going to be doing. I knew I was the first female to do this, so I had to do probably more than everybody else, because that's kind of how I was kind of grilled, or raised to push harder. So that's kind of what ended up happening.
How did you feel when you got the notice that you got the job?
I actually got a call from the Surgeon General, the acting Surgeon General at the time. So I had a phone call, and I fainted. I know specifically where I was sitting. I was sitting where I was sitting and getting that phone call from him. And I think first the assistant called in and say, stand ready for the call. And then it's like you sink, it's sinking, meaning like you feel like you're going to faint. Luckily I was sitting. I couldn't believe it. I was very, very surprised. It was very exciting to know that. And then all of a sudden you realize, oh no, I got to get ready for this.
You fainted.
No, I felt, you felt like, it's like that feeling when your blood rushes out. You just go, so yeah, fortunately I was sitting down. So
Yeah, it's like being on a roller coaster
yes.
and you're going over the crest
Yes.
and you're in the front car and you're looking down the hill and the rest of the other cars got to get up to the front and then you can all zoom down together. Yes, you got to see it coming.
Yes.
And then, yes, you went on the roller coaster for more than 4 years. I think I saw on LinkedIn you had 4 years, 2 months as that position, the Assistant U.S. Surgeon General. Congratulations on holding that position, first woman ever to hold that position, correct?
Yes, thank you so much. I'm hoping
You're welcome.
I'm hoping that that they select another female to be in that role here in the next cycle.
Yes, I'm sure there's so many qualified applicants, and I would not want the job of selecting the next one. It's probably very competitive, and there's a lot of great people out there. But, when you are in that position to pick somebody, I don't think you can go wrong. There's probably so many great choices, right?
Exactly. We have, like I said before, a lot of the folks in that role are just absolutely amazing, really good leaders. Everyone's qualified. It's very, very good.
Very good. Well, it's great to know that there's a great pool of talent to draw from. And earlier we had talked about teamwork. So let's move over to that topic. You had mentioned that when you were in South Dakota, you worked as a team. That was your first assignment, your first role with the Public Health Service, correct? You were with Indian Health Service and you worked as a team. Now, off mic, you and I had talked about how there's only one way to do it. We're going to work as a team. You talked about being trained to work as a healthcare team. It's not necessarily that you all have your silos, you all work as a team. Can you talk a little bit about that?
So yes, I'll talk a little bit about that. So part of it was, as I stepped back and as I left and I watched the private sector, I see a lot of it was due to we were in direct patient care. This is in direct patient care, and then that translates over when you get into these other administrative positions like at CMS and FDA and things like that, where you learn to work as a team too. There's all different disciplines where we are, and we were not incentivized for everybody to be okay, we've got to do this and who's getting credit for everything. What it was we were working with and I'm just going to go through some of the other categories that are in the public health service. We have physicians, there's nurses that are in uniform. We have environmental health. So think clean water, what's in our environment. We had veterinarians, that plays a big role. A lot of these diseases and infections, can come from animals, but then also like on the reservations, there were just a lot of animals too. So we always had veterinarians that were around. That was really important. We had engineers, if you think about it, like all our buildings. So we had every single category, dietitians, we had every single category that you would think public health. When you think public health, we were working together, and they have this expertise and you trust them. I trust them immensely. So anytime you have a question, I don't have to go learn it from scratch. I just go visit with them and get an idea or they give me a direction. So we learned all to work together. We'd collaborate together. So when we were managing even patients, working with them in the community, we would get to know all those other disciplines and work together. And it was just absolutely wonderful because it was just great to be around all of that. And then socially, outside of work, you get to know them too, and you get to know their families, and you even have more respect for their interests and everything like that. So it really helped a lot when we were living even on the reservation. And I lived, later on, we lived on the reservation, like in Tuba City. That's on the Navajo reservation. you see them socially outside of work and you really get to know them. And it was different than being in a city where, everybody kind of scatters after work. We saw each other socially, our kids played together. So it was a really great experience, and it's a life-changing experience for all of us. I really encourage students, when they are interested in the public health service, to consider going to one of these remote locations, because it changes you in a good way and it exposes you. You don't have to do it forever. My plan was only to do it 2 years and then, see what was next.
How long did you stay then?
Well, I was 2 years in Pine Ridge, and then I was 2 years in Tuba City too, and then I was 3 years on another reservation. So I would do 2, 3 years at a time, maybe, on the reservation. Some folks have been their whole career there, so they're involved in the community. They've married somebody that's been in the community. Their children all raised there. So I think it just depends on the person. I have my husband, and I was being very sensitive to him because he had his own career too. So we would move, and then we did it as a family. All our decisions were made as a family.
That's good. I'm sorry for that interruption. You were talking about you recommend students consider working in remote locations. Anything else you wanted to add?
Yeah, I think it's great. You learn a lot about yourself. You learn a lot about working with each other, and you realize when you're in this environment, you all depend on each other, and you get some good friendships. And the friendships that I have from the very beginning, from that first Pine Ridge, we're still friends to this day, if you can believe it. You meet these people because you're with them all the time. And anyway, it's a real good experience. Every single time we've moved anywhere, the relationships we developed have lasted. So I have physician friends and just different people that we met along the way. We just stayed friends the whole time.
I fully recognize that you had a culture of collaboration, both at work and outside of work. And on a work basis, though, there was an expectation of teamwork. You mentioned that nobody had to argue about who was getting credit for anything. I appreciate that, because in the real world, in the private sector, the civilian world, there is a little bit of that going on.
Right. So I'll give you an example, and this is probably a little bit for the students to hear too, of how pharmacy practiced when when I first came in. Part of it is some of the things they're overwhelmed with workload. And so it's not like, well, okay, we want to have everybody, so you have to wait in line or get an appointment. We needed to take care of the patients quicker. So the pharmacy can step up and say, hey, we can help with this. We'll take care of these quick, easy ones, quick, easy, screenings or whatever it is. I call them more the short acute. There's a place for us because we're trying to help serve the community, and it's not about who's gonna be the only person that can do this. So we didn't have that division like you sort of see, and hopefully we can move that. When I see the payment structure changing, when I see value-based care, when I see some of these other initiatives that are moving forward that are getting to where the payment, we have to change how our reimbursement is. It'll help fix that a little bit. At least I hope it will, because that's kind of how the VA was too. The same thing with the VA. Now we tracked workload, we tracked that, but it's not like your funding goes away when you don't have it. You still have to always be proving your value and the impact, and we learned to measure. We measured everything. We were constantly measuring, so we could show our impact, and we were collecting data to show the impact. So it wasn't the numbers like how many patients, but it could have been the outcomes too. We were looking at outcomes.
Very good. Do you see much of that in the private sector where people are measuring and proving value, or is that only beginning from what you've seen?
I think for hospitals and health systems, I think they're measuring all the time. I actually think it's moving that direction more. It's just in the early stages. A lot of it has to do with the reimbursement and tracking that, but payers are starting to get in there, and they want to collect certain data. So I think it's moving that direction. And fast forward 5 years from now, I think it'll be even more. It makes it easier. It's tedious to collect, so the more that systems can collect this automatically, the better.
Pam, tell me about working with tribes. How did that change your perspective about healthcare?
So I'll tell you a story of something that happened and the light bulb turned on for me. And we were working in a tribe, and they had gone, it's called 638, where the tribe takes over managing their care and they determine the direction of what happens. And when they have a board of directors, and so when they came in, they said, okay, we want wait times fixed. We want to have better care. We need better providers. We need our care improved. And from the pharmacy perspective, I'll tell you what they were looking at. They said, we are tired of getting the cheap drugs. You're always giving us the generics. We never get the brands. If I go on the outside, I can get the brand drug. There were things like that. So they were saying, and the tribe was determining the direction of the care. So we were very respectful and made changes. For the providers, they want real doctors. They didn't want these, and I'm saying it exaggerating because, so you get the idea. So then over time, new providers, very, very credentialed providers came in and were working there. The wait times came down. The lab values, like you look at the diabetes and the values had changed. They were tracking all that. So this is over a period of a couple of years. So the leadership at the hospital or the health system would go visit with the tribal leadership, the community, and say, we've done all these things. And they said, well, you're still not doing it right. And so they would go back, well, what are we doing? We've worked on the wait times. You can get in easier now. We've made all these changes. What is going on? And our metrics, look at all the metrics that we have that we show that we've improved care. And so they were looking at the lab metrics, improved blood pressure, improved diabetes. And this went on for a little bit. And at one meeting, so we have all the community in the room, one of the tribal elders stood up and spoke for a long time in the native language. And so this is basically what she sees. And after she was done, she sat down and everybody was quiet. She said it. She said what was important. And basically what it was is, you're doing all these things, but what was important to them. You're determining what you think you said what we want, but that's not what important. The important thing was the relationship with the provider. We want the provider that's interested in us, not just checkbox, we're out of the room. We want to know a little bit more about them. We want to feel connected. We want you to be nice. We don't want you to treat us like a patient. We want you to we want you to treat us different and not be afraid of us and not just feel like you're always in a rush. So it sort of opened my eyes and, wait a second, this is way different than we were trained. And so it made me a lot more sensitive to all of that. So we had to work to change our staff. And after that got explained to us, we really focused on that and hiring the right people that are going to listen. And you come in and maybe they come in and they get their medicine and the battery's out on their hearing aid. I'm not going to just, okay, go down here and go get your hearing aid. I'm going to walk them down there, and I'm going to make sure that they don't leave until they get their new battery. Or it might be not even to do with pharmacy, but it's really about caring for the whole person. And then we all learn to work together, like all the departments, we work together. So we work with podiatry. They would come in, they teach us, we can't see everybody, but if you can screen this pharmacy, if you can screen these, we'll take them right away. If if we see a infection in the foot, we want to see them right away. We don't want them to have to make an appointment. So we changed all our processes so that we would take care of them and we focused on them. And we weren't so hung up on the metrics. We were listening to what was important to them and getting their perspective and what they valued. So I'm going to translate that now to what I see for pharmacy right now. And one of the things, this is kind of my little pet peeve now for pharmacy is, people go and they get their medicine everywhere. You get it mail order here, you get specialty specialty here. You move around, people move around now. I go to this pharmacy over here. So now I have the only way to have a medication list is if I write everything down on a piece of paper. But there is nothing that where I can actually get the list all together. If the payer may have a partial list, I have these databases, maybe my provider has a list, but there's lists all over the place. Wouldn't it be just ideal if we can have on our app, on our phones, just a list of that we manage? This is me that I manage as a patient, manage my list. I decide who's going to get a copy of my list. I decide I can edit my list to how I really might take the medicine. I can add other things on there that I'm taking that maybe my provider doesn't know. That's centered about me, the patient, versus, the payers having a list, the providers having a list, everybody else having a list. And it's really, really complicated. It's kind of like my pet peeve. It seems like the patient, should be able to maintain a list. And wouldn't it be great if the pharmacist can help me make sure my list, help me make sure my list is current? But that needs time. That takes money to spend time, because I know that in the retail world, they don't have that much time, but somebody's got to take that time, because we spend an awful lot of time working about drug interactions, doing reconciliation. We always restart doing reconciliation. And if I go to the store and I buy an over-the-counter drug, how is that going to impact my regimen? Being able to use some of these, I say IT tools, or having access where I can really have my full list. Because right now, the only way to do it is on a piece of paper, which is really amazing to me. And this year that we still have to do everything on a piece of paper. This is for the people that are on complicated regimens.
Thank you for voicing your pet peeve. You are not the only one, I am sure.
Right, I know.
And I wanted to show you something. I know that this is an audio only podcast, but I bought this binder because I am in love with binders. I love paper. I'm a tactile person, and I have all kinds of pieces of paper from the years about not necessarily med lists, but just, routine lab work and just all the things. And when I go from having a full folder to needing the next step, I put stuff in a binder. And I know that off mic, via email, we were talking about, what are we going to talk about today? And one of the things that you had mentioned was medication lists and vaccine records and things like that. And I'm going to put it out there what I do. I'm letting my freak flag fly a little bit here. I still hoard paper, all the lists and the vaccine records and things like that, because sometimes I feel like it's harder. The barrier to getting the information is harder electronically than it is just opening up my binder and finding it. So what are your thoughts on that?
That's exactly what I'm talking about. It's like we should be able to solve this. And I actually, you're going to see real quick here, because this is my project for this next upcoming year, is to get this outlined and visit with my IT colleagues. And there's a lot of people out here that are really smart with digital that we should be able to figure this out. We should be able to figure this out. And we've made it more complicated, not we, but this, our system, our healthcare system has made it more complicated. We need it now more than ever. It's really, I watch people, like you go on a train, or you go on a bus, not a bus, but you go on the plane, or and you listen to people, they talk and they struggle and how they get it all straightened out. And I'm like, we should be able to work on this. So anyway, that's kind of thank you for the binder. Yay, we shouldn't have to carry a binder around with everything. I have my vaccine, the same thing. I'm checking right now on the vaccines, because I move around. I on purpose go get when I get an immunization, go somewhere different every time, because I'm waiting for the one day that I can get my record in one place. So I have it all over the place in several states, because I know one day they're working on interoperability. I should be able to get that, but I have to have paper in the meantime. So I'll carry paper around.
Same thing here. Yeah, interoperability. I love that word. Yes, hopefully, that is my hope, that someday you'll just be able to, scan a QR code and access all your information from this healthcare system and that healthcare system, and, maybe some scanned in documents from before they had healthcare systems. It's a struggle as a patient to have all this. And I care for a adult child with challenges. He's got autism, very low functioning, and his life is in a folder right now. It needs to go in this binder that I just showed Pam that I'm sorry you listeners can't see, but I found it on Amazon.com. And it just that I need to organize all this stuff because his providers are not always in network. He has a disability that requires specialists, and the specialists are definitely not always in the same health system. So I have to do what I have to do, you know?
Well, he's lucky to have you keep everything organized. So, yay. That's one of the
Thanks.
skill sets the pharmacists in general have. They're very organized.
Yeah. I have a sickness, I tell you. I love organizing information. It's a sickness, I'm telling you, Pam.
Oh,
I actually enjoy it. I do. But as for what you were talking about, yeah, it's good to have a vision of what you want, and I appreciate you sharing that. That's great.
yeah. Well, anyway, I do want to talk a little bit too about my colleagues in some of the work that they do too. So this is in serving because I know this is about Veterans Day, and it's about just their mission, being mission focused and passionate to be basically the public health force for our country. So they are sacrificing a lot, and when I realized that they were sacrificing is when I actually got more to the national level and I saw all the work they do. And I'll just give an example. Some of the pharmacists that are over in the FDA, when anytime there's a deployment or an emergency or just anything that's a crisis that's going on in our country that could be perceived as public health, I guarantee you our officers, there is somebody working basically 24/7. They're working all the time. They're deployed. They have this incident command structure that they go in and they are busy behind the scenes. Every time I see anything with public health, whether it be a drug, especially a drug, I know that one of our officers is behind it anywhere. So when I see the CDC coming out with something, I know that there's an officer behind it. And already we take care of the healthcare. The Public Health Service takes care of the healthcare in the Coast Guard. And I watch the DoD. They're working on putting out a new EHR, and so we have officers there too. So it's really neat. I kind of pay attention to the news now and watch all of this, and I'm just so grateful for their service and their commitment to to pushing and keeping moving forward, and and the sacrifice basically that they're doing, and away from their families, especially when they're deployed. It's hard on all the families when they're deployed.
I'm sure. Much respect to you out there that are deployed and serving our country. Thank you. Now, you talked about it being a very demanding job at times, and we all need a little support. Can you talk a little bit about the USPHS Women Leadership Support Group? How does that help?
Thank you for bringing that up. This is like this is a favorite group of people. So it started actually shortly afterwards, after I was selected as a Chief Pharmacist Officer, Assistant Surgeon General. After I was selected for that, a couple of women came up to me and just said, "How did you do it?" And I was a little bit perplexed. I wasn't sure what they were talking about, and I started visiting a little bit with them. And I said, "Let's get together." So we got together with some women. It started with 12 women at the FDA and pharmacist officers, and started meeting and visiting with them. And that's when I realized, so I was really fortunate. So I should probably tell you, when I took that role, I took it, my kids were in college, so they were already out of the house. I had a super supportive husband that was like behind me all the way. And he sort of pushed, and I said, "Do you think I should do this?" Absolutely. That's how his attitude is. I had a super supportive, I have a very close family, super close. Like my support system in my family, my brothers, their families, my parents, were all like, I couldn't ask for a better support system. So I always had that, and I felt very fortunate. So when I got there, I realized in visiting with them that there was mental health, this constant pushing, because remember, we're 24/7 sometimes. You have these deadlines, and it's not just going to work at 8 or 9 and getting off at 5 or whatever that is. We have these other projects we have to do. So it's constant working. I never told my husband, and hopefully he won't listen to this podcast. I always use my leave. I couldn't use it because I couldn't get away from the job long enough to use it. So that's not very healthy. That's not a good advice to do that. But we have leave, and it just never seemed right, like I could break away. The only way to do it is if we went out of country. Then I was off the grid. I could do it that way if I was out of the country. But what ended up happening is working through all that. It's really just trying on families. It's trying on their kids. How do you balance all of that? And just the mental health of pushing and not getting promoted. Those challenges there, we started meeting, and they developed several groups, support groups around the country. And it was basically, some of them, it could have been single moms. Some of them, it was having a caregiver for a family member, or for either an older or a child. We had different little subgroups that were out there that they could support each other and get through that together. And they are just absolutely amazing. And everybody chipped in a teeny bit. We have leaders, we had teams of people that were helping this. It was never on one person to do all of this organizing and coordinating. And it ended up being really good. And we also had education programs to hear from women that were like C-suite level women, that were just to hear how they did it, how they got through. I remember having talks on emotional intelligence, and we also invited guys too, so they can hear some of the challenges that women went through. And one easy one, and I'll just kind of give an example, is if somebody ever asked, "Hey, I need a volunteer for doing this," for me, I'd sit back and watch for a little bit. I'm not one to jump, "Hey, pick me," right away. I think about it for a little while. I kind of process it. I check with my husband. I make sure the kids are going to be okay. And so, for the guys, it was important to hear women aren't going to jump at opportunities right away, because we have to take care of those other little things, but give them time to process and get back so they think about it. We also don't think we're qualified. We think we want to move forward, just like I did when it was first suggested I put my name in my hat for this position. Of course, I didn't feel qualified, but then you think about it and you have people talk to you and you realize, okay, I'll figure it out. So the support groups ended up being support groups. It really helped to have a safe place to be able to have these conversations, and it just grow, and it continued to grow. I'm so proud of them. It continued on after I left, and it's been 4 years now, and they're just doing an amazing job, and they've got through COVID. That was like getting through the challenges of COVID. That was so critical. Like, all of a sudden you have the kids at home now. How do you do all this? So having that support group and keeping each other positive when you go through some of these challenges, to have a support group was really critical. Our mental health is super, super important. It's such a priority for our country right now anyway.
Congratulations on creating such a successful and helpful group. Are you still part of it at all?
Well, I'm not part of it directly, but they did ask me, and I just got to get some get on the calendar to come back and share with them again here, coming up here in the next month or two. So I'm looking forward to that. And they have shared with me when they accomplish something. So I'm in touch with the leadership there. So I'm so proud of them. That's why I can't believe when they sent me a summary of what they had done like a month ago. And I go, wow, you guys have done so much. They did it all, like they got together, then they did it on their own. I'm actually, I haven't told them this, but I guess it'll be out by the time Veterans Day. I actually am working on getting them some recognition because I'm so proud of them and what they're doing, and I want them to keep going. And this is not just pharmacists, by the way. It's all the different categories of women in the public health service. So, it's anybody that's a woman in the public health service. That's what it is for the Commission Corps there.
How do people find out about that? How do women find out about the Women Leadership Support Group?
So I think they have a network, and there's a Facebook page on it too that they have, and I think in the internal email that gets out, they have a network, and there's a website too, I think, because there's a website too for it too. So that's how they find out.
Okay, thank you for sharing that. I'll see if I can find a link and put that in the show notes too.
Okay, thanks.
Yeah, you bet. Is there anything else you'd like to talk about with that support group before we move on to the next topic?
Yeah, part of what they end up doing is, the world, it's about data all the time, getting data. They can listen to concerns that women are having, and they can pull that data together and present that to the Surgeon General to move forward. So things about, and I'll just give you an example. If you're a mother and just we always have to go through, and maybe they might be getting deployed and you're still nursing, things like that. So they can collect the data and give that back to the Surgeon General so they can help make policy decisions too. So that's been really invaluable too, and listening, because they have a voice, because they're a group, they have a voice, and they're part of another subgroup of another women's group, so they can collect all this data and help drive and make policy changes. That's how change is made, as you know, is you get the data and you pull this together and then review the policy and try to make some changes there to improve the lives and to help have them have a balanced life, have them as much as they can have a balanced life.
Again, it's that culture of collaboration and
Yes.
just speaking up and using their voice.
Exactly. Just like you're doing.
Absolutely. Yeah, but you've got some great themes going on in this episode where you're talking about how when you find out what's important to a group and you use your voice and you advocate for change, you will get it. You were talking about that tribe situation where they didn't feel like the relationship piece was in place. They felt like the metrics of the public health service, the Indian Health Service, was how you as an organization were describing how successful you were, but they didn't feel like your interaction with them was successful because the relationship piece was missing. Who knew, right? And the same thing with bringing concerns to the Surgeon General until people collaborate, let's say collaborate, and come up with an issue and propose solutions. Who even knows it's an issue? I give them a lot of respect for coming up with a list of issues and using their voice to bring awareness to them.
Yeah, exactly. And that brings to me, and I'm going to talk a little bit about, with some of the changes that are going on in healthcare right now, the people need a relationship with a human being. And so just if I have a question about my health, I want to go to someone that I want to be able to trust them, and I need to know them and have that relationship. So when we switch and move people around, it takes time to get to know someone. I know in our little community, we go to the grocery store and the people doing the checkout, and the people in the meat department, and you get to know everybody in the store, and they know you, and you may not know the name, but you can wave and you have a little chat with them. But imagine having to go to a different store every time, or just wherever you go, whatever you're doing. The same thing with pharmacy. I think it's being able to take time and get to know people so that you can ask that question, should I get this vaccine? I hear there's another one that came out, that you're going to trust that answer. And it takes time to get to know people. That's why people go to their family, if you have a good support system. So I think the healthcare system in general needs to put more emphasis on that human connection instead of everything just being so remote. That's my 2 cents. I'm in a rural area too, where we live. And I will tell you that just is emphasized even more because neighbors take care of neighbors. Everybody in a small community, and it's really great to feel part of a small community. It really, really is.
I would second that. I grew up in a small German farm village in Northwest Ohio, if you can believe that. I don't even know if there was 1,000 people. Maybe there were 1,200 when I was growing up. I think there's a little bit more than that. But we all our families all immigrated from the same part of Germany. And that's why I say I grew up in a small German farm village in Northwest Ohio because everybody was from Rudenhausen, Germany. And that's kind of cool because you all kind of know each other and you look out for each other and you know where so-and-so's grandma lives. And when you drive by and you see an ambulance there, you know to call the family and say, hey, did you know this is going on? And it may feel like you have no privacy, but people are watching your back.
Right, I know. So isn't that nice too? It's nice. And then if they know you have an expertise in something, they're going to come ask you, hey, what do you think about this? And I'm
Mhm.
sure you being a pharmacist, that's what they would say. Oh, because I know our whole neighborhood, if they know they know I'm a pharmacist, they're going to come ask me anytime there's a drug. They ask me, which is dangerous right now. I usually have to go look something up if it's too new.
Yes, but I think you're a good resource. Let's just say resource. You may not have the answer, but if you don't, you can say, hey, I want you to talk to your family pharmacist who has all your medication list on a computer, not in a binder, on a computer. And
Right,
they can address your concerns. And this is maybe a really good question to ask. And that makes you a great resource, even if you don't have the answer.
right.
Yep. All right. Well, there's a couple other things that I'd love to talk to you about here. You are part of a PBS documentary right now. Would you like to talk about that?
Yeah, thank you for mentioning that. So what happened was, during the COVID, I had an opportunity to work with a producer, and we had a that we had it was he did a PBS show, and I was just kind of helping him connect him with different people and connect him with pharmacy folks. But what it was called the misinformation virus. So this is all about misinformation that was being put out there about the vaccination and COVID and things like that. So it wasn't only COVID, it was just all vaccines. So anyway, as I got to know him, he found out I was a public health service commissioned officer, and he had never heard of us. And we sort of internally talk about us being the visible core, even though we are a public health force. I mean, there's 6,000 of us total. There is at least 1,300 pharmacy officers that are out there. But I guess in the scheme of things, that's not very many, not compared to the armed forces and the other military who have quite a bit more. So anyway, as we got to know each other and I introduced him to different people along the way, we came up with the idea of he came up with an idea of let's do a PBS program on this. And so that's what we've been in the process of doing. So I know that as of now, the filming is completed. And really what this is going to all be about, it's going to be about, the title of it is called Invisible Core. And basically it's an education program about public health. It's about our officers. He filmed several of the different categories. Some of the things that people don't realize is that we have public health service officers that work at the National Park Service. So you'll see a little bit of that. They do a lot of the like environmental or engineers. There is a lot of that background that works there. He interviewed several of the former surgeon generals and talked to them. Had talked to people that were high up in the government, and so in the different categories, and of course, pharmacy is included in there too. So I'm real excited about this. It's in the process of being edited. They're planning on showing it in May of 2023. That's when it'll be done. It'll be nationwide PBS program, and it's the first one that's really been about the U.S. Public Health Service Commission Corps. So we're real excited to be able to just educate people about this really important uniform service. There's 8 uniform services. This is one of them. So we're really excited to be able to educate people about this. So we're also going to be hitting up the schools, and reaching out to the schools when it's available, and hopefully get an opportunity to use that opportunity to talk to the schools, talk to students, and we'll have all the categories represented too. And then there's going to be little segments that we can put out that'll talk about either the different categories, talk about public health. And our country would not be where we're the only uniform service that is dedicated to public health in the world. So we have this really unique expertise. And I'm always so impressed when I learned so much being part of the program. Because I had a chance to listen to what he was going to talk to them about when he interviewed them. So I was able to listen in on it. And I'm going, oh my gosh, I had no idea our officers did that. So here I had a whole career in it, and I didn't even know what all the other disciplines, the things that they were doing. I was overwhelmed with, and am very proud to be part of this service.
Oh, I'm sure you are. And were you interviewed as part of the documentary as well?
I was interviewed as part of the documentary as well. Yes, I was.
Nice, nice. Well, I'm looking forward to seeing that in May 2023 on PBS, right?
Yes.
Awesome. Well, I hope that it all comes together beautifully. And is there anything else that you'd like to talk about when it comes to federal pharmacist service or uniformed services? You have the floor, ma'am.
Okay, thank you. This in honor of Veterans Day, I just really am grateful to everyone that is in a uniform service, that is out there serving our country, sacrificing for our country. And, that we have one of the most dedicated group of people. This is not only public health service, this is all our sister services too, that are out there serving our country. And I'm specifically involved in healthcare. And I know that there's pharmacists in several of the different sister services too, and that they're working hard, and they just do this because they want to serve their country. And I just want to say thank you to all of them for they do, and then for all the times that they're away from their family, and just being some of the best human beings that we can be around, best human beings. So thank you for your service.
Well said, and thank you for sharing that. Not everyone hears the call to serve. Pam, I'm glad you heard the call and you answered it. And thank you for your service. And thank you for being here on the Pharmacist Voice podcast today to share how you use your voice as an advocate for the pharmacy profession. You take care.
Okay, thank you.
You're welcome. Thank you, veterans everywhere, for your service. And thank you again, Rear Admiral Pam Schweitzer, for being my guest on the Pharmacist Voice podcast. I was inspired by all the roles she served during her career and the support group that she started, the mentoring that goes on in the public health service, and how Dr. Schweitzer is now using her voice in retirement to advocate for the Public Health Service Commissioned Corps in the upcoming PBS documentary. There was a lot of great information in this episode. Dr. Schweitzer has used her voice in so many different ways. It is inspiring. Now, as for that PBS documentary, I plan to watch it, and I hope to share it on social media when it comes out. We all need to speak up for what we believe in and try to make a positive impact in this world. That's all I've got for you this week. Thank you for listening to episode 185 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to read the show notes. There's a link to Rear Admiral Pam Schweitzer's LinkedIn page, the Public Health Service Commissioned Corps, my social media links, and more in the show notes. Please feel free to reach out to Dr. Pam Schweitzer or me and connect. If you know someone who would like this episode or needs to hear it, please share it with them. And subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thanks again for listening. I'll be back next Friday, November 18th with a solo episode. It is my fall 2022 update. I'll talk to you next week.